Hi, I am Dr. Nurfaraz Khan, and today we are going to talk about the scapula or shoulder blade, which is a flat triangular bone that forms the back of the shoulder girdle. It articulates with the clavicle and humerus to form the shoulder joint. Understanding the anatomy of scapula is crucial as it plays a vital role in the movement and stability of the shoulder complex. Okay, now we will start with the borders and angles of the scapula. The first one is the superior border. Okay, the superior border is the shortest border of the scapula, running from the superior angle to the coracoid process. Now this one is the superior angle. Okay, the second one is the medial border. This is the longest border extending from the superior angle to the inferior angle. It lies along the vertebral column. Look, here is the inferior angle. Okay, next is the lateral border. This border runs from the inferior angle to the glenoid cavity and forms the posterior boundary of the axilla. This is the inferior angle and this is the glenoid cavity. Now we will talk about the angles. The first one we have is the superior angle. It is a thin and relatively pointed, forming the highest part of the scapula. Okay, the next is the inferior angle. The inferior angle is thick and rounded, providing attachment for several muscles, including the teres major and teres minor. Next we have the acromial angle. The acromial angle is lateral and forms the base of the acromion, which articulates with the clavicle. Look, here is the acromion. And this is the attachment surface for the clavicle. Now we are going to talk about the surfaces of the scapula. It has two surfaces, anterior and the posterior one. The anterior surface, it has subscapular fossa. This is a broadened cavity that provides attachment for subscapularis muscle, which plays a crucial role in internal rotation of the shoulder. The second surface is the posterior surface. It has two parts, the supraspinous fossa and the infraspinous fossa. The supraspinous fossa lies above the spine of the scapula and provides attachment for the supraspinatus muscle, which is essential for initiating abduction of the arm. The infraspinous fossa is located below the spine of the scapula and give attachment to infraspinatus muscle, which is responsible for external rotation of the shoulder. Now we are going to talk about the different structures of the scapula. The first one is the glenoid cavity. This is a shallow, oval-shaped articular surface that articulates with the head of the humerus, forming the shoulder joint. Let me show you how the joint is formed. As we can see, the head articulates with the glenoid cavity. Now the next is neck of the scapula. This is the slightly constricted region surrounding the glenoid cavity. Okay, next we have the infraglenoid tubercle. This small projection is located just below the glenoid cavity and serves as an attachment point for the long head of triceps brachii muscle. Okay, now we will talk about the coracoid process. This curved beak-like process projects anteriorly and laterally from the superior border of the scapula. It provides attachment for several muscles and ligaments, including the coracobrachialis, short head of biceps brachii, and the coracoacromial ligament. Now next we have the suprascapular notch. This notch is located on the superior border of the scapula, just medial to the coracoid process. It allows passage for the suprascapular nerve which innervates the supraspinatus and infraspinous muscles. Now we have scapular spine. This is a prominent ridge that runs across the posterior surface of the scapula, separating the supraspinatus and infraspinous fossa. The upper lip of scapular spine provides attachment for the trapezius muscle. The lower lip of the scapular spine gives attachment to the deltoid muscle. Now we have the acromion process. This is a flat curved process that projects laterally from the spine of the scapula, forming the highest point of the shoulder. It articulates with the lateral end of the clavicle and provides attachment for deltoid muscle. Now this one is the articular process of the scapula. This is a small oval shaped facet on lateral end of the acromion, where it articulates with the acromial end of clavicle, forming the acromio-clavicular joint. I hope you guys understood the concept. Thank you.